Good morning, everyone. I'm KP George, Fort Bend County Judge, standing in front of you today to give you some important information, what is happening in Fort Bend County regarding COVID-19 and COVID-19 vaccination. That is actually the talk of the town these days. And so there are so many people out there, and we get a lot of people calling, texting, emailing about when we are getting our vaccine. And I always promised we are working behind the scene to bring that vaccine to you. And that kind of yielded some good results, and we wanted to announce and let our citizens know that we are going in the right direction. We have received a large quantity of vaccine as of last night, I believe. I just wanted to thank some of our delegation from Fort Bend area, especially Senator Kohlhorst, and she made a sincere attempt to make this happen and also designate Fort Bend County as a vaccination hub. What does that mean? That means we will be getting vaccine on a regular basis, maybe most likely like a weekly basis, we will be getting vaccines. So we will continue our effort to vaccinate as many citizens as we can. And vaccine hub doesn't mean it is not one location, but of course, as we always mentioned, you need a registration, you need an appointment to go to the vaccine administering location. And I hear there is a lot of discussion out there. People walked in and got, shot without registration and all. And as far as I know, that is not true. And we are following strictly, because that actually enable us to provide this process in a orderly fashion. And so Fort Bend County alone have received around 12,000 vaccine, and that will be administered on a regular basis every day. This vaccine, as of now, we are doing we are doing almost 1,400 vaccines a day. That will be doubling and tripling today onwards as of now. Those who are listening to me, the pre-registration hub is now open. It is www.fbchealth.org. And registration is, again, I repeat, the registration is only at the moment for 1A and 1B. And so with that, and I will invite our Health and Human Services spokesperson, Rita, to give you the specific details on it. Rita, please come forward.
Thank you, Judge. So my name is Rita Obi, and I'm the spokesperson for Fort Bend County Health and Human Services. I want to talk with you just a little bit about registration, because it's changed just a little bit. Now, the first part of registration is still the same. So they'll go to www.fbchealth.org, and they'll complete the application. Now, here's where it's a little bit different. Whereas previously, after you completed the application, you would simply wait on someone to give you a call to schedule your appointment. Now you'll receive a message that says, in the coming weeks, you will receive an email where you can schedule your own appointment. So let me just say that again so we're clear. So after they complete the application, they'll receive a message that will say, in the coming weeks, you'll receive an email where you can schedule your appointment. And what's good about this is, rather than waiting on the call, you can go ahead and schedule the appointment for the available times at your convenience. We know that everybody is, kind of antsy about waiting on calls sometimes, and we understand. So we wanted to make the process a little more amenable to what the public was asking for. So that's the first thing, and that's with respect to the Pfizer doses that we have received. Now, once you get the email, and it'll be over the coming weeks, so some will receive the email sooner than others, right? Because We can't send them all out at one time. We have received 12,000 doses. So in order not to crash the system, we're going to send the emails out in phases. So throughout this week and probably through next week, people will be able to receive the email explaining how they can register for the vaccine and get their appointment. Now, this is the thing that's also important, is there will be a personalized link in the email. That means it's a one-time, one-use, one-person link. So that's with respect to Pfizer, which is our first dose vaccine. We've got great news for our residents who received their first dose of Moderna vaccine from Fort Bend County Health and Human Services. We now have the second dose vaccine that has come in. You will receive an email or a phone call letting you know when your appointment is scheduled. Please be aware that the call is going to come from an unknown number or a private number. Keep your phone with you at all times. We're asking everyone to please keep their appointments. Please plan to arrive 15 minutes early, just as you would to your doctor's appointment. This will help us to remain scheduled on time. It will also provide courtesy to your fellow neighbors, and it'll ensure that you're able to get your vaccine at your appointed time. Thank you.
Thank you. I will also, I wanted to remind, this is a huge undertaking. I was able to visit one of our locations, and more than 150 people working there, volunteers, our employees, and also contract staff, to make this happen. 1,200, 1,400 vaccine administered in a kind of a seamless fashion. And so there's a lot of people working behind the scenes, and I wanted to thank each and every one of them. And being said that, the people working behind the scene, I wanted to invite our Office of Emergency Management Manager, Mark Flathouse, to give a brief update how we are preparing. And this is right now we have one location. We will be opening more, at least in the immediate near future. We will be opening at least one location in each precinct. So we are in the process of doing that, and so there's a lot of effort behind the scene happen. And so, Mark, if you would explain how your team is preparing and coordinating that effort.
Good morning. The Office of Homeland Security and Emergency Management, one of the things that we're doing is we're taking the guidance from the Judge's Office and HHS, Health and Human Services, to put together more vaccination sites in the future. Hopefully in the next week to 2 weeks, we'll be rolling out more vaccination sites so that we can get the numbers as the vaccines come in, and we can make sure that the public has many opportunities to go to whatever's closest to them. We're reviewing the sites, working with different partners, trying to make sure that everything is in line. As the judge stated, the current sites that are in place right now take a lot of people and a lot of uplift to make sure it's coordinated and the logistics are there. Homeland Security Emergency Management staff, we're here to put that together and work with the different precincts, the commissioners and the judge's office, to make sure that those sites are in place, and they're very fluid as putting people through it so that there is not a long wait, and it makes it very convenient for everybody. So what I would like to say is the partnerships that are in place and the people that we work with, we couldn't do it without them, and the different jurisdictions. Thank you.
And also, I just wanted to mention, talk about partners. And when we received this 12,000 pieces of vaccine, and a total allocation of it is around 34,000, and which is distributed to two of our partners, predominantly a chunk of it. One is Memorial Hermann and also Methodist Hospital System. So while you are communicating with FBC Health, I encourage you to, that is 100% available for our citizens. And last night I heard some of these hospital systems announced that they will be started taking registration from public. That is for administration that need to be administered to the public. So please try different avenues, and they also have around close to 11,000 each of our partners have. So please reach out to them also if in case you cannot get through to FPC Health. So avenue, look in different avenues, pursue different avenues so that you could get your vaccines done faster. And also, I mentioned it is we are going to be receiving vaccines on a regular basis, maybe a weekly basis. So we will, as and when we get more vaccines available, more spots will be available, and to be patient, you will get your vaccine. And also, when you got your vaccine doesn't mean, there is no need to follow the CDC guideline. Wear your mask and keep your social distancing and avoid large gathering until we get something we all call herd immunity in our community. So please do your part, and we are doing our part. Let's all help together. This is a fight we make it happen together, and that's the only way we can win. So I encourage each and everyone to do their part so that we could, manage this, pandemic. We wanted to put this pandemic behind us, move forward, and I'm hoping soon, maybe by next 4 months, 5 months, by summer, we will get back to a little bit of some kind of normalcy, and that's my hope. Let's all work together. With that, if you have any questions, I will happy to answer.
Judge, just to confirm, that was 12,000 doses of the Pfizer vaccine the county received yesterday?
That's, yes.
And that does not include what Memorial Hermann is doing at this
That is correct.
Okay.
That is correct.
Separate.
That is separate allotment they are receiving. So it is total maybe around a little over 30,000. So each, they all are our partners, community partners, yeah. It's separate.
This Pfizer 12,000 is strictly for the county?
Strictly for county to administer, yes.
Your Honor, has all our first responders, EMS, doctors, nurses, police, firefighters, have they all been inoculated already?
No, and that is actually, maybe I will pass that question to Rita, because unfortunately 1A and 1B doesn't categorize profession other than frontline medical workers. Is that correct? Please go ahead and answer that question.
So thank you for that question. No, not every doctor and nurse has been vaccinated already. We always reserve some for the 1B partners, obviously. Their ability to be able to take off work, to come in, to get registered, sometime kind of may hamper their being able to do so. But no, at this time, I cannot tell you that every doctor, nurse, or EMS has been vaccinated.
What about firefighters and police? People who come in direct contact with people with COVID a lot.
Well, it's the same there. It's the exact same there. So also keep in mind, so we have a reserved amount. We always put that aside. When it gets closer to time, so for example, there will be a certain amount who come to get the vaccine, and then as we're getting smaller and smaller doses that are available and they're not coming in to get the vaccine, we go ahead and release it to the residents because we know that there's another shipment coming.
So, excuse me, Rita, so are you guys working with Fort Bend County Sheriff's Office? Is that, I guess, to just touch on his question here, how is that working? And can emergency crews register online?
Absolutely. What I can say right now is a portion of the Sheriff's Department has been vaccinated. I cannot tell you that the entire staff has been vaccinated. I don't have that information right now, but I can get it for you later.
And how important was it that you guys made it more convenient for residents to make their own appointments?
Well, I'll put it to you like this. If you were registering and you were to wait on a call, sometimes, I don't know about you, but for me, I might get a little nervous. Are they going to call me today? Are they going to call me tomorrow? Well, when you get that email, you can take care of that yourself right then or at your convenience. And so it gives a little bit of control, if you will, back to the residents. And that's always important and is always valued.
So right now, is this considered a wait list? So can anybody sign up here? Is it just 1A, 1B? And is there a limit to how many people can register right now online?
It is absolutely Group 1A and Group 1B. So we adhere to the Texas EVAP, and that's what the requirements are right now. And yes, they can go online and they can register. We have 12,000 doses available. We encourage them to register. We want to be able to take care of our residents. We'll get them in the system. And as I mentioned, some will receive an email sooner than others because, you have to go through the queue. But when you receive it, go ahead and register and get your appointment. That's what we want you to do. That helps us to schedule better, and it helps the residents to feel better about being able to control when that appointment time is, as opposed to someone calling you saying this is your appointment time.
When those 12,000 slots are filled, today, in the next 3 days, however long it takes, will then you shut down, or do you continue to take them and then put them on a wait list? Like, how does that work?
So we do not have a wait list. And you know what? And that's a very good question. So there have been a lot of misinformation and disinformation. And so thank you for allowing me to clear up a few things. Certain persons have been circulating a URL address saying you can register here. Well, that was a defunct and old URL that we had that is no longer in use. And so they've been, registering on that, even though on our website it clearly says pre-registration is closed. So there are some people who think that they are registered because they got it off of social media, but it didn't come from us. There was also a time when certain persons were indicating that you could just walk up and get a vaccine. We require an appointment. And if you think about it, it's not really fair to your fellow neighbors who took the time to register. We will never post something that does not have our name, our logo, and the appropriate information. And if you're wondering about it, give us a call. We have a vaccination hotline that people can call if they have questions about our system, and that number is 832-473-1373.
Yeah, I just wanted to reiterate all this discussion, all this thing we are doing to make this administration of this vaccine orderly. And so please follow our social media, Office of Emergency Management and Health and Human Services social media, and also their website. We will be putting out information if there is any update comes. But moving forward, definitely we will stay connected with us. That is the bottom line. And so please, once again, follow the CDC guideline. And I appreciate this. Thank you for coming this 8 o'clock. Too early. And so I appreciate you all being here. Let's all get back to work. And, thank you once again. My reassurance is we are doing everything possible. We will continue to do everything possible to vaccinate everybody. Stay tuned. Thank you.